canned spinach. Nothing any worse than canned spinach. That might have some oxalates in it due to the cooking of it. Raw spinach, oxalates, just remember, cooking binds and bonds. And that's the problem with chemistry. Yeah, thank you. She likes what we do. I have 2 questions for you. I've been doing raw foods for 4 months, but using some rice and potatoes when fruit not available. I had a lymph node removed from right armpit. My face is breaking out now and more on my right side of the face. Well, I hope that's not the lymph node to that side of the face, because this becomes very problematic in removing lymph nodes where cells are feeding into them. They think of nothing when a lymph node swells. These guys, I mean, forgive me, medical doctors, but if you guys don't turn around, you're gonna have to answer some criminal charges, because you're doing things to the human body that's criminal just because you don't understand it, and that's not good. That's not acceptable. We have to join, not be separate. You got to forget the American Medical Association and the power freaks, and grab a hold of your profession and get it back to where you start pouring love into your profession. View these videos as medical doctors and learn how to turn your practice into a thriving healing practice. That's what you medical doctors need to do. And send a little note to the man who started you, the World Banker man. We know him. And the same with his son, and start telling these rich people to go take a hike, because we are now changing our focus to healing and helping people. So this is a good case where that could have been a lymph node that dealt with the drainage of this side of the face. That would be very problematic if that was the case, because if there's not a lymph node there to remove the lymph from the cells, boy, this is tough stuff. And in some cases in the head area, I hadn't been able to save them. So let's just say that's not the problem, and just keep moving your lymph. That's a problem. Right there was the problem for them to remove it. They had to remove a lymph node. It had to be swollen and hard. And so that was just telling that you had kidney failure. Kidney failure to the point where you could still pee, but you're not filtering your lymph. So this is a case, sweetheart, where you've got to start fixing your kidneys and start moving. This is the kidney channel right here, and you really just got to get those kidneys filtering and then clean these lymph nodes. So I would be using lymph node 2. I definitely use stomach and bowel number, or whatever you need, and a lymphatic 1 capsules. I would take 2 kidney formulas, 1 liquid, 1 capsule, and really tear this up, because you want to make sure that this face comes clean, because that's a sign of lymph backing up. And if it's on the same time the lymph node removed, I mean, it could just be your whole lymph bed is probably backed up there, but you really want to get to this and get moving and clean this face up. And I mean, this whole lymph, it's just the lymph system here, but having a lymph node removed is not good. It's like removing tonsils. You know, they think of nothing of removing tissue like that, and it's like, that's insane. That's just not. That's problematic. Nutritionist said, I will get fatty liver because too much fructose. Excuse me a minute. Oh, yeah, I feel better. Jesus Christ. That's why the word nutritionist, don't any of you become nutritionist. That's like low man on the totem pole. Nutrition, you're going to go to school for nutrition? That's easy. That kind of comment was insanely ridiculous. I mean, I don't even want to comment on it. Ugh, simple sugar, dear. I mean, maybe your rice and potatoes, but that's not even what causes fatty livers. It's the lymph system. Fat is the body's main anti-inflammatory, particularly cholesterol, your triglycerides. All this is used in the event of lymph, brain and nerve, anti-inflammatory, steroid production, stuff like that. So whenever you see fatty tissue anywhere, that's acidosis and the response of your body to acidosis. Not a favorable response in the terms that tissue becomes fatty, but saving the cells from mutation is considered better. But actually, when moving the lymph, then the fatty areas come out in the liver or wherever. It can be kidneys, it can be anywhere. You could have fatty tissue everywhere, heart, liver, lungs, doesn't matter. And it's just because fat is the body's main antacid or anti-inflammatory, if you want to use that word about that. So get there and move lymph, and you'll be okay. And I wouldn't go back to that nutritionist. I think that nutritionist needs to get another livelihood. This is the stupidity that's out there in health. Makes you want to throw up. Young, loud, and 88. You're 88? Nah. Dr. Morse, I was mostly raw vegan for the past year, but recently ate some animal foods again, raw milk, eggs, fish, and began seeing strange things in my stool. I have stopped eating those foods and went back to eating vegan. I am interested in your parasite tinctures. I would be too, probably. Yeah, was wondering if you could talk about the best parasite removal protocol. Thanks a lot there. Yeah, I probably would. Everybody should deworm themselves. At least once every couple of years, I'd say, I've said this before, I think we only have about 30-35% parasitic invasion in humans, at least in my office here. But we do see some people have quite an inventory. But I like the GI, the parasite G. We did have a parasite GI, but either one, you want to do a capsuled parasite G and maybe a liquid parasite M. And I would probably do that if you feel like you have some invasion or some buildup of the bigger boys. Spend at least a month. I'd spend at least a month getting rid of them. I would probably do 3 or 4 parasite Gs 4 times a day, and the same with maybe a couple dropperfuls of the parasite M tincture 3 times a day, and really do a pretty good kill in you. I did the Hannah Kroger years ago, and it was up to like 20 of like a parasite G type capsules and stuff, and I thought it was a really overkill and stuff. Really, at a moderate pace here with herbs, you'll get a good kill. They really don't deal with these herbs well, so you don't have to oversaturate yourself with herbs. But as a woman, don't freak out either with them. That's just what they are, and you just have to make a kill in the body. And Parasite M is a formula for fungus and microbes, protozoas and things. So between the Parasite G and M, you did a pretty good kill in the human body. Again, some people have them all the way in the brain and everywhere else. So if you suspect you have issues, it doesn't hurt to continue down that road, because the herbs aren't going to hurt you. Isn't that beautiful? Yeah, that's the problem with meat and eggs. They're putrefactive. This planet doesn't keep that stuff around long. Yeah. That's why the GI tract of a carnivore, a true carnivore, is only 3 times the length of their spine with minimal, not maximal, minimal absorption. Our GI tract is 12 times the length of our spine with maximum ringed absorption. Huge difference. So when you start looking at the makeup of meat eaters and stuff, they are different totally. So this whole concept is ridiculous. If you want to eat dead animals for emotional support, go ahead. But don't eat it for the health of it, because you'd be fooling yourself. Hi, Dr. Morse. This additional information I need to send with my question. I will say, Kelly, I gave Drew your stuff there, but I didn't see anything. You go after that same parasitic thing we're talking about here, but you take off down this, get back on the herbs, get back on your focus. Don't lose your focus. You're driving, you're riding around, you're walking, you got your mobility back, and you just keep tearing it up, honey. Just keep tearing it up, and you'll have your whole life back within, you're getting there, so you don't have that much longer, and you got your health all back. Let me see. This odor when I have a bowel movement is a discharge from my nose and female area. My urine is clear, and will the Heal All tea help me? I can't afford a protocol. Yeah, absolutely, sweetheart. This is Latasha, Nard. Absolutely. I would douche with it. I would cut it a little bit and drink it. Definitely want to get on a raw diet and really move lymph. That's the odor of proteins and stuff. The stinkiest chemistry on the planet is proteins, and so this is this is just the lymph backing up and not moving well. So definitely move your lymph and get to where all your fluids are sweet again. Hello, Dr. Morse. Could you please address? Can't even pronounce it almost. Encephalomyelitis is a full recovery. Absolutely. My dear friend is suffering from this disease and is very worried that he will not be able to regain his cognitive function. Anytime you see an itis, whether it's in the brain, of the myelin sheaths, of the mylar, of the brain, it doesn't matter where the cells are, the tissues are, you're always going to find blood and lymph. You're always going to find blood and lymph in these tissues, and that always is going to result in acidosis when that lymph part of that fluid isn't moving well. Blood doesn't move well, that's a no-brainer. But when the lymph doesn't move well, that's acidosis / inflammation. Then the suppression of function, whether the lymph can suppress the function of production of neurotransmitters, serotonins, and the like, or opposite, where the acids just are now breaking down the cells. So the impact of a very acidic fluid, the suppressive nature of that to the function of even blood flow to a cell. And this can affect even the nerve function to a cell. So blood and nerve gets beat up a lot through lymph. Lymph is the over-residing factor that you see such a flux of chemistry, where the blood doesn't. You can't flux blood chemistry too much, not without being very sick, if not dead. So it's the lymph can play that fluctuation game from extreme acidosis, but I would say most systemic acids are not hotter than 3. So for oncology to treat at 1.5 to 2 is insane. No one treats with acids. I mean, that's another, we've been over this many times, and it's just a very sick, puking type of thinking that you could ever imagine somebody treating an acid condition with acids. Every judge in the court of law, state or federal, should wheel at that. These judges need to learn a little bit of that so they'll understand they're being lied to a lot. But again, it's about policy and who cares. Medical doctors, you know, they paid all that money to go to school, and you know, we wouldn't want to ruin our economy by telling people the truth, and we're overpopulated anyway, so we need to kill a few million every year, I guess. I mean, that's the kind of thinking that would have to be out there with the Rockefeller. Did I say Rockefellers who started the Medical Association? Woo-wee. Same lady here. Hi, Dr. Morse. I had a bad body odor. I smell funky fish, and when I have a bowel movement, it smells like cheese. Yuck. Also, I have parasites. I'm eating more fruits and veggies. I would like to know, will parsley and carrot juices and apples daily give me body fluids that good smells? P.S. Love your channel. Learning a lot. Love you, dear. Thank you. Yeah, that's connected to this other one here.